Even with reopening the state, coronavirus is still a real threat. And joining us now to talk about how COVID-19 can impact wound care patients is Dr. Zeb Ali, System Medical Director of Advanced Wound and Hyperbaric Medicine at Hartford Healthcare. Thank you so much for joining us, Doctor.
Great. Thanks for your time today.
So can you explain to us what is wound care and why is it so important?
Yeah, so wound care is a very specific subspecialty we deal with. It sounds like it would just involve your usual cuts and scrapes. But the type of wounds we deal with usually have an underlying disease like diabetes or circulation or poor nutrition, etc. These wounds rarely heal spontaneously. They usually require specialized treatment. They're important because in addition to non-healing, they can lead to significant complications, such as severe infections, bleeding episodes, significant pain requiring medication, and worst of all, even amputation with permanent disability.
So obviously COVID-19 has had an impact on these wound care patients. What have you been seeing in the last few months?
So initially, because coronavirus truly was a novel virus, it was new, and we didn't know that much about it. It was very aggressive and contagious. It kept our wound care patients at bay. They wanted to stay at home, rightfully so, because of fear. And the same with us. We didn't know much about it at that time also. But that created a dilemma because of the reasons I just mentioned. These people really do need to be seen. And despite the pandemic, it was kind of tricky balancing who should be seen, who shouldn't be seen. So now that we've learned more about the virus and the safety measures that Hartford Healthcare ensures are taken prior to visits, our patient population has slowly started to return to our centers, which I believe is the correct thing to do at this point.
So you just mentioned a lot of those people might have been apprehensive about going into the hospital. What would you say to them if they are fearful because they have open wounds?
So at this point, it's correct that they are fearful. That would be the way to go. However, coming back to the hospital environment after we've learned so much over the past few months, Hartford Healthcare's policies are based on the CDC. We practice screening for both the staff and the patients. The facilities are cleaned significantly at the end of the day and in between patient encounters. We have waiting rooms that minimize congestion. There's plenty of hand hygiene stations. Everyone is wearing masks, and then the staff wears protective equipment, and we minimize congestion. So taking all those factors into account, your chances of picking anything up by coming for a wound center are far outshadowed by the benefit of the visit. So I would encourage people with chronic wounds at this point to at least call us so we could direct you in the right direction. If not, set up a telehealth visit where we could even look at the wound and guide you that way.
Okay, Dr. Ali, thank you so much. Very useful information. Thank you for your time today.
Great. Thank you also.